What are the early signs of heart failure? Yes.
I am Professor Dr. Vivek Gupta. I am Senior Cardiologist in Delhi Apollo Hospital. And today it is 4th of September 2024. We are seeing patients more and more of heart failure. I want to make to the public especially to know that heart failure is not cardiac arrest. Heart failure means there is some disturbance in the hemodynamics of the left ventricle or right ventricle, which can be because of reduction in the ejection fraction, that means pumping capacity of the heart, or sometimes it is because of the problem related to diastolic relaxation of the heart. So there are two types of heart failure. Heart failure, I told you, is because it leads to increased left ventricular and diastolic pressures, which leads to decreased exercise capacity and also sometimes increased breathlessness, difficulty in breathing. Because of the increased left and diastolic pressure, it leads to increased LA pressure, which transmit into the pulmonary veins. And finally, there is a pulmonary edema, which leads to increased oxygen demand, a decreased oxygen supply, and therefore the patient is breathless. I told you there are two types of heart failure. One is systolic heart failure, one is diastolic heart failure, to be very precise. In simple language, two types, systolic and diastolic heart failure. But now we have a different definition. Heart failure with preserved ejection fraction, where the systolic function is normal, and heart failure with reduced ejection fraction, where ejection fraction is reduced. That means normally ejection fraction is about 60%, comes down to 45 or less than 45 or 40 or 35. So heart failure with reduced ejection fraction comprises of the most of the heart failure patients, but some 20-30% patients of heart failure is because of the preserved ejection fraction, where when you do the echocardiography, the heart functions, systolic heart functions, are found to be normal. So we are dealing with heart failure. The symptoms are mostly similar. The most important symptom of heart failure is decreased exercise capacity. That means you get fatigued. Early features, you get fatigued on walking. That means whenever you take bath, you feel tired, or when you walk upstairs, you go a little more tired than this. This is very early heart failure symptom. Second early heart failure symptom, that you get breathless on walking. सांस फूलने लगती है, you feel breathless on exertion. And third is, of course, the late still the patient progresses, then you have a breathlessness on rest. And very early feature is also orthopnea, which is that means this is something when you lie down and you have start feeling breathless because of some hemodynamic disturbances leading to increased capillary wedge pressure and leading to increased requirement of breathing. Heart failure is a serious condition. It can lead to death, not suddenly, but mostly these patients have a slowly progressive cardiomyopathy type of features, and they progress faster. Normally 5-year survival is much reduced as compared to the normal population. 5-year survival is much reduced as compared to the normal population. But of course there are treatment available. Early detection is very important, and the patient sometimes comes directly as acute left ventricular failure. For example, recently we had a patient who came with acute LVF. In the emergency, required ventilation, artificial ventilation, and of course we did angioplasty. Patient survived. So early detection can be done by regular echocardiography screening. We always tell all the patients, especially who are diabetic, hypertensive, those who patients above 40 years of age, those who have mild symptoms of breathlessness, to go screening of the overall body screening and heart screening especially, and that includes echocardiography and of course X-ray chest, lipid profile, and treadmill test. That means walking on the treadmill. The cause of the heart failure is mostly because of ischemia. That means the blockage in the coronary artery, which leads to myopathy-like condition, or any previous heart attack. That means the patient had acute MI, which was not detected or not treated completely, and the patient has got reduced ejection fraction. And sometimes hypertension alone, that means diastolic heart failure, especially the preserved ejection fraction patients, is because of the long-standing high blood pressure, and they have a relaxation abnormality of the left ventricle. And these patients will have symptoms of heart failure which will require medical treatment. Mostly the preserved heart ejection fraction patient, that means diastolic heart failure patient, require only medical treatment. But those patients who are a systolic heart failure, where the ejection fraction is reduced, these are more serious patients, and they require, first of all, coronary angiography to rule out any major arterial blockage. This is very important. And if angiography is found, if we find that blockages are there and which can be leading to severe ischemia, we'll do angioplasty stenting most of the time. Sometimes bypass surgery is also required. Then we wait for 3 months to see whether this patient ejection fraction improves or not. Sometimes mostly it improves. If it does not improve more than 35% ejection fraction, then we'll like to put a AICD, automatic implantable cardiac defibrillator device, which is actually prevention of sudden cardiac death. Very important, AICD prevents sudden cardiac death. The patients of heart failure who have ejection fraction less than 35%, they have high risk. In fact, those who even around 40%, they have a high risk of ventricular tachycardia, ventricular fibrillation leading to sudden cardiac arrest, and patient will die very suddenly sitting at home, or even walking or mild exercise, they will die. If you put a pacemaker like AICD, then these patients will have an automatic internal shock, and the patient will be revived automatically even if patient is sleeping. So this AICD is very important, and the patient should always be treated with the AICD if there is a ejection fraction less than 35%. But I personally recommend that any patient who has an MI, even with ejection fraction around 40-45%, who have a necrotic myocardium, they should also be treated with the AICD. This is something which I personally feel. Guidelines say less than 35%, but I have seen a lot of patients dying. I want to tell you that you feel so sad when the patient dies of sudden cardiac arrest. Patient did not receive AICD because the indications are only less than 35%. I have many people who are known to me, and I can of course share on this video. One of my professors, who is the father of Tabi and almost to get Nobel Prize, my mentor, my personal friend from France, he had a sudden cardiac arrest. If he had AICD, similarly Raju Srivastav, the famous comedy, if he had AICD, he would have survived. So this is a very important device. I'm again stressing to the public, they should know that it's a little expensive, but this is life-saving. So I told you that heart failure systolic, first do angiography, if required angioplasty, if required bypass surgery, put AICD if required. And finally, there is a device known as CRTD. If you have left ventricle branch, then you put a three lead pacemaker, which also helps. Sometimes all these devices do not work. Then finally you have to put a LVAD, left ventricular assist device, which is like an artificial heart, which is kept inside just below the heart, and it gives additional pump to improvise the heart function so that the patient does not have breathlessness. And finally, if there is end-stage heart failure, the patient may require heart transplantation. Heart transplantation is not easy because to fetch a heart, to get it transplanted is not easy. It is only coming from the patient who have died because of some other reasons. Then only you can remove the heart. There are 2 kidneys, but there is no 2 hearts. So 2 kidneys means you can take out 1 kidney and the patient still survives. So you have a very living donors. But in heart transplantation, you cannot have a living donor. You have a dead donor. Dead donor means somebody who has died because of some other reasons, and the heart is okay. Then you can take out the heart within a stipulated time and do a transplantation. So heart transplantation is the final treatment. But many patients are so sick that they are not eligible for the heart transplantation. So heart failure detection is very important. Early detection of heart failure, I told you, is important. If somebody has a low ejection fraction or a preserved ejection fraction, you should do a medical treatment, proper medical advice. I have summarized in this thing, in this small story. Heart failure is a serious condition. It does not mean cardiac arrest. It means reduction in ejection fraction or some hemodynamic disturbance inside the left ventricle, which leads to increased in pulmonary capillary wedge pressure, which leads to breathlessness, fatigue, exertion, chances of sudden cardiac arrest. Cardiac arrest will happen in the patients of heart failure. Heart failure is not cardiac arrest. So these patients have to be treated very regularly. Angiography, angioplasty, bypass surgery, AICD, CRTD, these are different devices. Then of course LVAD, and then finally heart transplantation. So these are the small things. Thank you very much for watching this video. I think you will understand more and more about this. You can get it translated to Hindi also. so that more public from Hindi they can understand this heart failure. Thank you, Dr. Vivek Gupta from Senior Cardiologist from Delhi Apollo Hospital on 4th of September 2024 at around 6 p.m. Thank you.
Thank you so much, sir.
Wow, sorry. पूरी
Sorry.
जो pathologies है
पूरी,
आपने
sir.
तो explain